So a 76-year-old woman is referred to the gynecology clinic with prolapse symptoms. She had a vaginal hysterectomy 30 years ago because of uterine prolapse. She has no urinary or bowel symptoms and is sexually active. Clinical examination confirms vaginal wall prolapse. With respect to the choice of operative procedure, or anterior and posterior trip, and apical prolapse is there.
They are all TVL minus 2.
Yeah, yes.
So they are stage
4, ma'am.
4. More than equal to TVL minus 2 is stage 4.
4, yeah. So I will go for...
this is a complete vaginal wall prolapse.
Yes, ma'am. So I will go for K, ma'am.
Yes. So abdominal sacrocolpopexy is a better option for above the sacrospinous ligament fixation. And moreover, she is sexually active. So SSF is never an option when the patient is sexually active.
Sexually active, yes.
Very nice. Good one.
Sorry, can you mention how you got the staging again?
Staging? How do we stage it?
Yeah, you said stage 4.
Yes. So just remember, whenever there is all the points are above minus, then they are stage 0. Anything which is stage 1 is in between, when the stage 0 criteria is not met, and any leading edge is less than -1. If it is greater than -1 but less than +1, it is stage 2. This is not from your RCOG guideline. This was some book. And when it is more than +1, less than TVL minus 2, it is stage 3. Anything which is leading edge, any leading edge which is greater than equal to TVL minus 2 is stage 4. So here you can see that TVL is 10 and the leading edge are TVL minus 2.
8. Yes. So
okay?
Yeah. Yes.
Okay, thank you.
Yeah.
Ma'am, which option is more better in the sacrocolpopexy, abdominal or laparoscopic?
Both are okay. For laparoscopy, they say it is done at a rarely, because people are not so much trained, and sacrocolpopexy is a very difficult procedure to do. But if you see with respect to the post-operative recovery and everything, then you have to always mention lap is better over open.
So if both
because
options
when you
are
answer,
there,
you answer on the holistic approach.
But like if both the options are there, so we should go for the laparoscopy?
Lap, yes. Then they
Is
will
there
give
any
you something in the question that the doctors are well trained and it is a bigger center or something like that.
Ma'am, is there any cutoff age for after which laparoscopy should not be done? No?
Nothing like that. Nothing mentioned in their guidelines as far as I know.
Okay, ma'am. Thank you.